Hi, my name is Alex Williams, and I am a sports medicine teacher at Hamilton High School, which is in the health science and medical technology sector. For the lesson today, I will be focusing on standard B12 and specifically objective B12.3, which is demonstrate the knowledge and delivery of specific skills and procedures as outlined within the scope of practice appropriate for patient care in prevention, diagnosis, pathology, and treatment. So for the lesson today, every day when the students walk into the classroom, they can check the whiteboard to see what's on the agenda for today. So I put an objective on the board. Students will be able to fully understand the principles of spinal immobilization, because that's what we're going to be covering today. We're going to cover how to properly provide spinal immobilization to a patient with a neck or spine injury. So they'll see as they come in, the warm-up is going to be a discussion. Then I'll do a brief lecture covering the pages in the textbook that relate to spinal immobilization. And then we'll do a lab where they get to practice the hands-on skills of spinal immobilization. So for the warm-up, I'm going to show them a short video. The video is about 1 minute long, and it's going to be showing a professional basketball player who suffered a neck injury. So they're going to see the athlete get injured in the video, and then to go with the video, I have a discussion question to get the class started on critical thinking about what they would need to do to treat this injury. So the discussion question is, if you were working as an athletic trainer and you witnessed this injury, how would you respond? What do you think you would need to do to provide emergency first aid for this athlete? So this warm-up will get them thinking about the lesson to come later on. So this is the opening slide for the presentation on spinal mobilization. It just shows graphics, kind of get the students interested in what we're going to be learning about today a little bit more after seeing the video, and kind of giving them an introduction of what they will be learning. Then I'll go through a quick presentation on the basics of how to do spinal mobilization. With this particular lesson, most of the emphasis will be on the hands-on practical skills, so the direct instruction portion will be pretty short. The direct instruction portion should only take about 5-10 minutes max if students have questions while I'm presenting. So I'll just go through the steps that the students need to follow for spine boarding an injured athlete with a neck injury or spine injury. So I'll go through the steps. The examiner needs to stabilize the head and neck, perform a primary survey and retrieve the spine board. If the athlete is prone, which means they're on their stomach, they'll need to be log rolled onto their back in case they need CPR or in case they need to be spine board. And then I'll go through how to do a log roll. All extremities should be placed in axial alignment. Neck must be maintained in original position as you log roll a patient. The spine board should be close to the athlete, and each assistant is responsible for a segment. So this is done as a team. The minimum amount for a good log roll would be 3 people, 1 person at the head, 2 people at the sides. And then the person at the head always gives commands, so the person at the head will be giving the commands to the rest of the team as they log roll a patient onto the backboard. Once the patient is on the backboard, their head and neck needs to be continue to be stabilized. If the patient is a football player, they'll have a helmet and shoulder pads in place. You'll need to leave the shoulder pads and helmet in place, but take the face mask off. The trunk and limbs will be secured first once the patient is on the backboard. Then the head and neck will be stabilized with strapping and blocks. And then the rescuers will position themselves so that they can pick the patient up, and then the spine board with the patient on it can either be carried from the field or loaded into a transport vehicle such as an athlete. So this is a skill that the students could use if they work in sports medicine or emergency medical services such as EMTs and paramedics. So after the direct instruction portion, I'm going to show the students how to do the spinal immobilization skill. So I'm going to break it down into several steps because that will help them learn it a lot easier than if I were to show them everything in one step and expect them to learn it all. So the first thing I'm going to have the students do is assessing CMS. So CMS stands for Circulation Motor Sensory. That's one of the first things they need to do in the spinal mobilization skill. So I'll show them a video on how to do it properly. Then I'll do a demonstration with the student as my patient, and then I will let them work in groups of 2 to practice the skill together. After that, after they've shown proficiency with the assessing CMS portion of the skill, I will move on to showing them how to properly size and apply a cervical collar. So what I'll do, again, I'll show the video, I'll demonstrate it with one of the students as a patient, and then I'll have them work in groups of 2 to practice the skill. Once I determine that they are proficient with this individual skill by informal assessment while I'm walking through the room and observing, I'll move on to teaching them how to do the log roll. So the log roll is important because if you do the log roll incorrectly, it could cause further injury to the patient. So first I'll show them the supine log roll, which is the easier of the 2 log rolls. I'll show them the video, I'll do a live demonstration, and then I'll have them work in groups of 4. That way they have 3 healthcare providers and 1 patient in their group. They'll rotate through until everyone gets a chance to practice the log roll, and then once I determine that they are proficient through observation, I will move them on to the prone log roll, which is a little bit more complicated. Once again, I'll show the video, do a live demonstration, and break them up into groups of 4 where they can practice the skill with their group members. So once again, it'll be 3 people doing the log roll and 1 patient, and they'll all rotate through so everyone gets a chance to be the commander at the head with this skill. After they've successfully learned the log roll, I'm going to have them do D-ring strapping, which is the most complicated portion of this skill. So the strapping normally takes the student several days to get down, because not only do they have to do it correctly, they have to do the whole skill with a time limit. So I'll show the video, and then I will do a live demonstration, and then I'll break the students up into groups of 2 because they only need to have 1 healthcare provider and 1 patient in their group. So I'll have them practice the skill until they get proficient. Once they're proficient with the D-ring strapping, we'll move on and they'll do the whole skill top to bottom. So before they get tested on the skill, I will have them practice everything top to bottom following the rubric that they will be tested on. So at this point, I will give them the rubric. This will be theirs to hold on to while they are practicing. So the rubric outlines exactly what they need to do for the skill, and it also is the same rubric that EMTs and athletic trainers are graded on while they are in school. So this rubric is industry standard for the students, and if they demonstrate proficiency, they get signed off on the skill, and they need to be able to perform this skill with a score of 80% or higher accuracy with 0 critical fails. So what that means is it's out of 14 points, they have to get 12 out of those 14 points correct to get 80% or higher. And then down here are critical criteria. So if they miss one of these, that's a critical error. They can get 0 critical errors to be proficient. So 80% or higher of the total score plus 0 critical errors equals proficiency for the students. So what I have them do to practice the skill as a whole complete unit is I'll show them a video from emtprep.com where they do this skill just as it would be in the proctored practical exam. So they watch this video, I do a live demonstration, and then they practice it in groups of 4, so that way they can have 3 healthcare providers, 1 patient. They all rotate through, so that way everyone gets a chance to be the leader of this skill. And they will use the rubric while they are practicing. That way they practice it the same way they're going to be tested on. And once I deem through observation that they are proficient, I will hold the proctored exam. So what I'll do for the proctored exam, for them to demonstrate proficiency, I will test one student at a time on this skill. So they will have partners because they need help with the log roll and they need a patient, but only one student is being tested at a time. For the test, I have them perform the skill top to bottom from memory. So they have to perform the skill, verbalize each step they're performing, and score 80% or higher with 0 critical errors to be considered proficient in spinal immobilization. So this is one of the lessons that I teach in sports medicine and emergency medical responder. It normally takes a few days to complete this whole entire lesson. The guided practice normally takes up the majority of the time, and then testing takes a day or two depending on how big the class is. For emergency medical responder, they get 3 attempts at this skill to receive their certification at the end of the year. So they can fail 2 times, and as long as they pass the 3rd attempt, they can receive their emergency medical responder certification at the end of the year. So once again, this lesson is tied to standard B12 and objective B12.3. So they're learning skills that they will use in the industry if they were to work in this field.